Hello students, this is Dr. Ways and welcome to your lecture on the posterior thigh. So when we refer to the posterior thigh, what we're referring to is that region in the posterior portion of the leg below, or inferior rather, to the gluteal fold and the inferior margin of the gluteus maximus, all the way down to the popliteal fossa. And we've already seen that the sciatic nerve is the main nerve that supplies the muscles to the posterior compartment. So what we'll do is expand on that just a little bit throughout this lecture. Much like as we saw in the abdomen, the fascia of the leg, the thigh and a leg, is a continuous layer and divided into two sections. One is our superficial fascia, and we don't see the superficial fascia in this picture, but think of it as continuous with the superficial fascia of the abdomen, where it contains a lot of areolar and adipose tissue. And the superficial veins that we covered in the overview of the lower limb would be contained within that layer. And then deep to that, you would have the deep fascia. So that name makes sense. And the deep fascia is generally considered to be our fascia lata, and that is going to be another continuous sheet of connective tissue that surrounds all compartments of the leg, anterior, medial, lateral, and posterior, and then is continuous with the deep fascia of the leg, although down there it's not called the fascia lata. It has a thickened region on the lateral portion of the leg called the iliotibial tract, and remember that IT tract is connected to both the tensor fascia lata as well as the gluteus maximus, and its role is basically to stabilize the hip. And just to mention, in the anterior portion, we have this saphenous opening through which a branch of the femoral vein, known as the saphenous vein, can go through and enter the superficial fascia of the thigh. So this is a cross section of the thigh, and take note that the anterior is here and posterior is here. So the section that we are concerned with is this, that's in a more of an orangish color as opposed to the pink in the other compartments. And notice that there are 1, 2, 3, 4 muscles within that compartment, and it's separated from other compartments by this intermuscular septae. So these basically continuations of the deep fascia, whose job it is to keep muscle compartments separate from each other. And the 4 muscles within that compartment would be collectively known as our hamstring muscles. All right, now what we're going to find in the next slide is that this muscle right here is not, we're not going to cover as part of these muscles because it is part of the adductor magnus. And remember, the adductor magnus we talked about in a previous lecture has 2 parts. One is an adductor part and one is a hamstring part, or a posterior compartment part. So we're going to cover it collectively as with the adductor muscles, but realize that part of it does play a role here in the posterior compartment also. And notice that part is also invested within the fascia of the posterior compartment, so it really does act as a separate muscle from the other part of that adductor. All right, so I don't expect you to know the origins and insertions of all of these. I put them in these lectures just so you get an idea of where they're located, where their attachments are, so that you can get an impression of how they perform the function that they form. So like, look them over to that extent, but I'm not going to test you on those specific parts. So the way we want to look at this is, if we go from, this is the lateral side and this is the medial, and we know that because we have the ilium here facing outward, as well as the greater trochanter right here. And remember, the greater trochanter was always the lateral portion. of the femur. So this would be lateral, this would be medial. And going from lateral to medial, we have our first muscle, which is the biceps femoris, our second muscle, which is the semitendinosus, our third muscle, which is actually deep to the semitendinosus, the label that 3, semimembranosus, and then 4 here, we would have our hamstring portion of the adductor magnus, which again, we're not going to go over in this lecture. All right, as far as action goes, the posterior compartment muscles, or the hamstrings, are involved in knee flexion. So if you look at their attachments down here on the tibia and the fibula, that would be their insertions, they're going to contract and pull those muscles, thus bending your knee at an acute angle, otherwise known as flexion. So these are going to be our knee flexors. All right, you notice that they have some role in extension of the thigh at the hip joint, but primarily they're going to be used as knee flexors. All right, and remember, we talked about the sciatic nerve that runs through here is the one that supplies all the muscles of the posterior leg in general, not just the thigh, but the lower leg too, with innervation. So you're going to see the sciatic nerve appear as the nerve that supplies innervation to these muscles. Now, if we look specifically at the biceps femoris is subdivided. There's a long head, which is supplied by the tibial part of the sciatic nerve. And if we look here, here's the long head. That would be more medial, and the tibia is more medial. Whereas the short head, which is more lateral, is supplied by the common fibular part of the sciatic nerve. And that makes sense because the common fibular part is on the lateral aspect of the sciatic nerve as well. Not much to say as far as nerves are concerned because we've already gone through them. Here's your sciatic nerve, and you can see the line between it, dividing it into the tibial part and the common fibular part. Extends all the way downward, and you see the branches coming out and going to the muscles that we just covered in the previous slide. And then here at the popliteal region, you see the sciatic nerve physically dividing into the tibial nerve and the common fibular nerve. All right, so as it courses down past the popliteal region, they will continue as those separate nerves and give off more branches that innervate the musculature of the lower leg. The blood vessels that supply the posterior compartment of the leg originate from the femoral artery, which is right here. Notice that the external iliac artery up here, as soon as it passes through the inguinal ligament right here, then it becomes the femoral artery. And right there, as it sits within the femoral triangle, is a spot that you'll want to know because that's where you will palpate for your femoral pulse. So then the femoral artery branches into this deep artery of the thigh, and the deep artery of the thigh pierces through the adductor magnus muscle, which is this fan-like muscle that you see right here, into our perforating arteries, first, second, third perforating artery, and then the terminal end of deep artery of the thigh down here. And those perforating arteries are what's going to supply the posterior compartment of the thigh and then meet back up here with the femoral artery until it passes into the popliteal region, which then it will become the popliteal artery. All right, so we said that the popliteal region, or the popliteal fossa, was the inferior border of the posterior compartment of the leg. And so what specifically the popliteal fossa is this triangular shaped region that is bordered by 4 muscles. The semimembranosus and semitendinosus on the medial side here, the long head of the biceps femoris on the lateral side here in the superior region, and then in the inferior region by the medial head of the gastrocnemius and the lateral head of the gastrocnemius and the plantaris on the lateral side. So those are the actual borders of the popliteal fossa. Within the popliteal fossa, from lateral to medial, you'll find the tibial nerve, the popliteal vein, and the popliteal artery. So going from lateral to medial, we have nerve, vein, artery. Or if you want to go from medial to lateral, artery, vein, nerve. Either way, remember those the order. So the vein's always in the middle. Nerve is always lateral. All right. And within that popliteal region, since you have your popliteal artery, this is going to be another place where you're going to be able to feel a pulse along that popliteal artery. Covering the popliteal fossa is simply that deep fascia that we mentioned before, and then over that would be your superficial fascia and then skin. You'll also be able to find the common fibular nerve along the lateral border of the popliteal fossa as well. But it's still going to be a nerve, and it's still going to be lateral to the other structures. So the other way of looking at this, since this is a 3D structure, even though we're looking at it in a 2D image here, so this will be really good to see in a laboratory, especially on the anatomage table, is that from anterior to posterior, so the other side of the knee to this side of the knee, you'll have the artery, vein, and the nerve. So the nerve's going to be closest to the skin of the popliteal fossa. Then the vein is going to be more anterior, and then the artery is going to be more anterior to that. So another way of saying that is the nerve is the most superficial, the vein is deep to the nerve, and the artery is the deepest of those three structures. So a common theme that keeps appearing that we've seen is that there are connections between arteries called anastomoses that are in places where circulation is potentially easy to cut off. So if you look at the femoral artery coming down here, there are several branches that come off, and I don't care that you know these branches, but realize that they are connected to each other, and all these connections have branches as well, that allow for a redirection of blood supply if any one of those gets cut off, so that you aren't lacking in blood supply to this particular area. So, around joints, very important to remember that there are these anastomoses that keep blood supply continuous.